Okay, Grover Norquist here with Leave Us Alone with Grover Norquist. Leave Us Alone is both a video and an audio podcast. Today we're going to be talking about COVID, the shutdowns that came because of COVID or not. What did that do to liberty in America? What do we do moving forward? One of the real experts in this field, Phil Kerpen. Now, I remind you, if you like what you see and hear, be sure to like and follow us on Facebook and subscribe to Americans for Tax Reform on YouTube. Hitting the thumbs up button would also be greatly appreciated because your engagement with the show helps more people learn about it. If you're more into audio podcasts, you can Leave Us Alone with Grover Norquist on Apple Podcasts, Spotify, and Stitcher, or wherever else you get your podcasts. Be sure and leave a review. That's awfully helpful. Phil Kerpen is with us today. He is the president of American Commitment. He is a nationally syndicated columnist. You should be getting his stuff. He's the chairman of the Internet Freedom Coalition and author of the 2011 book, Democracy Denied. Phil, you have followed the politics of liberty and COVID and the response by the federal and state, local governments more than anyone else. And I was wondering if you could give us a sense on the damage done, what actually happened, who was lying about what, and then I want to pivot to, are there things that we come out of this better? Some of the responses to COVID actually increased individual liberty, but a whole bunch of them didn't. What is your sense of how this played out, and I guess through that, how it can be avoided the next time?
Well, I think, Grover, first of all, thanks for having me on the show. I think that the biggest lesson was that there's not a whole lot that governments can do besides developing effective medical interventions. And, that means we can talk about the success of Operation Warp Speed in particular. And really, it was a triumph of cutting red tape more than anything else. That was much more significant than the public funding, was the fact that they allowed trials to move much more rapidly than they ordinarily permit at the FDA. But, I think the lesson really is that other than that, other than sort of the things that can encourage the more rapid development of medical interventions, there's really very little that governments can do that stops a highly contagious virus. And, they can act as if ordering people into their homes or ordering them to wear masks or closing schools will have some great public health benefit. But the truth is, we had more or less convergence in terms of the virus outcomes, regardless of whether places did any of those things or all of them, and how long they did them and how aggressive they were with them. And, early on, it looked like some places were more successful and they were lauded and praised, and then they sort of had their turn and they went through the bad virus curve just the same as everywhere else. And I think that in particular, the urban areas got hit first, and then the rural areas sort of filled in the winter. And one of the things that I think a lot of people miss is that the peak of this pandemic was not the original spring peak in the northeastern states. It was not the southern peak last summer in the southern states. The peak everywhere pretty much was in January, in winter, when you would expect a respiratory virus to be peaking, is really when it peaked everywhere. And it wasn't the case that all of these interventions and all of these policies and the masks and the distance, it just wasn't the case that they were effective. We just don't see much evidence that they had very much effect at all in terms of the course of the virus. Unfortunately, which was extremely deadly for older people in particular. And 80% of all deaths with COVID are above age 65. And so, and we knew that from the very beginning. And that's why I think the state that really did the best job in terms of the virus was actually the state that was constantly attacked for doing too little. And that's the state of Florida, where they recognized pretty early on, I think they had a lockdown that was 3 or 4 weeks compared to, a lockdown of a year in many places. And then they basically said, look, this is a disease that overwhelmingly is a high risk for older people. That's where we're going to focus almost all of our efforts. And Florida has a lot of old people. I mean, it's one of our oldest states. And yet, when you look at the COVID death stats on an age-adjusted basis, they're towards the bottom. I think they're 40th out of 50 states when you use age adjustment on the COVID.
How would they compare to New York? Because for the longest time, Governor Cuomo was the anti-Trump. Trump was doing everything wrong. Cuomo was doing everything right. At least that's what it seemed to be on TV.
New York is depending on how you look at the numbers, New York and New Jersey are either 1 and 2, one way or the other way, in terms of the worst mortality impact of the virus. And, you can say it's because they were hit so hard before anyone knew what was going on, and there is something to that. But ultimately, the only way you can judge it at the end of the day is what was the total burden of disease. And it was bad in those places. And in particular, those are two of the states that, I said there's not much government can do short of developing medical interventions that really helps. Well, there are things government can do that really hurt. And in particular, those states and a few of the other states that had really the worst outcomes had this catastrophic policy of forcing highly infectious patients into nursing homes when those nursing homes were not well equipped to prevent spread through the rest of their facility. And
in retrospect, that sounds stupid, but on the face of it, it sounds stupid.
Yeah, right. Well, the interesting thing is, this is the one thing that I give Gavin Newsom credit for. And, I'm not a fan, and I think he did almost everything else wrong in COVID. But he was one of the states originally, back last spring, that adopted that same policy, that Cuomo policy, along with New York and New Jersey and Michigan. He revoked it 2 days later because there was this backlash. All the nursing home operators said, look, this is going to increase deaths. It's going to increase problems at the hospitals because they're going to infect people. They're going to come back with, the whole theory of this was you're going to free up space in the hospitals by sending people back while they're still infectious. And what the nursing home operators said, and the backlash happened everywhere, but they were ignored in a lot of these states, what they basically said is, look, you're not going to free up space in the hospitals because they're going to come back, they're going to infect everyone in the building, and you're going to, where you had, you freed up 2 beds, but now you're going to have 100 because we're going to have to call 911 and move all these other residents. And so, I think that argument convinced Newsom. And so he had the order, but only for 2 days, and he reversed when the backlash happened. But the backlash happened in all these states, and I think New York and New Jersey kept it in 5 or 6 weeks. And that was one of the drivers of why they had such high mortality in that spring wave. The interesting thing now that we can say in retrospect is the seasonality of this virus really was a traditional winter peak, like we have with flu and other respiratory viruses. So why, we had a little bit of a spring wave this year, but it was very, very small, very minor. And so this question is, why was it so bad the first spring? And, I think it was a combination of two things. One is that it was new, so we had no population immunity. But the other, which I think is still underappreciated as a factor, was the states that really drove those national death numbers all had some version of this policy of sending highly infectious patients into the nursing homes.
Okay. What were the good things that came out of this? Because at Americans for Tax Reform, we put together a list of several hundred local government, state government, even federal government deregulation, which helped. You mentioned deregulating the process of getting a vaccine to market. How much did that speed it up? Because they were telling us 2 years and it took less than a year. Why? What did they do differently? What was the nature of the deregulation?
Well, it's interesting because when Trump said he was going to get a vaccine within a year, the New York Times ran this infographic where they said the normal development process would take until 2033. And if you accelerated everything as fast as anyone could possibly accelerate it, then it would be by, I think, 2024. Okay, that was what they said was the totally unrealistic, super optimistic, best case scenario. And of course, we had it before the end of the year, as Trump said we would. And in fact, we probably could have had it even earlier. There were some questions sort of at the end, slow walking the data. And, I think they might have been able to do it by October, as he originally promised, based on the data that was available at the time. And, the answer to your question of how was it done so quickly, it wasn't the government funding, although a lot of government funding went to a lot of the vaccine companies. But, the first one to get their data in and get their authorization was the Pfizer vaccine, which did not take direct government funding. They had a very large purchase order, but they did not take grant funding, and they funded the research and development with private dollars. But the key to that vaccine and all the other ones was this collapsed process of doing all the testing. Normally, they require you to sequentially do phase 1, to do preclinical animal testing, then to do phase 1, then to do phase 2, then to do phase 3, and they're all one after another. What they did with Operation Warp Speed is they said, you can start everything at the same time. As long as you get all the data that we need, when you ask us to do the authorization, you don't need to wait for animal studies to complete before doing phase 1. You don't need to wait for phase 1 to complete before doing phase 2. And so they were able to launch all of these studies once they had viable vaccine candidates, basically in parallel rather than in sequence. And that's what dramatically reduced the time to get that accomplished. And this was actually set up in a 2019 executive order. So this was something that the White House Council of Economic, it was actually the National Economic Council. One of the exercises that they did before anyone had ever even heard of COVID was they looked at, how can you limit the economic damage from a pandemic, sort of as an exercise. And what they came up with, the number one thing that they came up with was, if you really accelerate vaccine development, you can use it to truncate a pandemic, to actually stop it in its tracks, rather than it being sort of an after the fact to prevent a recurrence, which is what we've had in the past. And so they actually had the groundwork for this set with remarkable foresight. They had the groundwork for this set before the pandemic even came. And I think if they had not done that, maybe they would have been able to adopt the same changes on the fly, but there's no way it would have happened as quickly, given how slowly the gears of government turn. And Casey Mulligan has a really interesting video on this, because he was working in the White House when they put this together. But it's a remarkably untold story that policy change was already in the works, was already essentially set up before the pandemic came. And I think that there are other aspects to it, and obviously there was a lot of government money involved. But the biggest change was this idea of if you get us all the data, we don't care what the order is, essentially.
So now something like this was done with the effort against AIDS to speed things up, but it took a while. What was the comparison with the effort to get the anti-AIDS medicine out faster?
Well, obviously, we never developed a viable vaccine. There's still work going on that. So that one's, it's interesting. I think just to appreciate how remarkable it is that we got a COVID vaccine in less than a year, we've got, 35, 40 years of work now on an HIV vaccine, and we still haven't been able to do that. So vaccines can be very, very difficult. But we did develop really successful treatments. And of course, we went from AIDS being a death sentence to being something that's essentially, a manageable chronic condition. And so, there certainly were successes. I don't know exactly what was done in terms of the regulatory pipeline on that, but I don't think, I think it was qualitatively much less than what they were able to do on this, which is really sort of a pretty remarkable achievement. And to answer your broader question, Grover, of the good that came out of this, I would actually say that the number one silver lining from a policy standpoint of the past year has been the explosion in school choice that we've seen at the state level. And 16 states have adopted newer expanded school choice programs in their legislative sessions this year. And I think that was a direct reaction to seeing what the teachers unions did and the insistence on school closures and masking and all of these efforts that impose such hardship on children, and sort of the sense that, look, they're not on our side, that we need to have other choices. And, to me, kids suffered the worst consequences of the COVID interventions because they were never at risk themselves, but they were forced to really sacrifice. But in terms of the upside, I think that's going to be the enduring silver lining of this, is a huge number of people who've never been politically involved or ideological in any way now see that they cannot trust the public school system to educate their kids, and they cannot trust teachers unions to represent the interests of children. And that's led to this just massive boom in school choice expansion at the state level.
At the same time, I know you and I and others have been working for decades on trying to deal with the guild situation, where people get a license to be a doctor or a nurse or a dentist or a hair cutter, barber in one state, then you move to another state, and all of a sudden, you got to do 3,000 hours or go to school, get a degree. It's very difficult to transfer your occupational license permit from one state to another. And we even were fighting to get it for the spouses of people in the military, where your husband or wife was moved to a military base in Texas, and your license to sell, real estate from New York doesn't transfer. It was like pulling teeth to get that. And yet there was an explosion during the COVID year of liberalizing the rules there that are permanent, not temporary.
Right. And they were, the worst version of this was what Cuomo did, where he said, "Yeah, we'll waive the requirement, but you're going to have to pay New York State income tax on all of the time that you spend in the state." But you're absolutely right. There was a huge liberalization of all of the licensure associated with physicians and nurses, in particular, being able to go to where they were needed. One of the things about this disease that we now see in retrospect is it's not like you got huge peaks and they stayed that way. You got these huge peaks and then they fell, and then someplace else would peak. And so if you were able to move resources, you could prevent any hospital system from being overwhelmed. And we actually did that pretty effectively. No place really was overwhelmed, except maybe to a certain extent New York early on. But that depended on when it really mattered. There was no safety rationale behind, a licensed doctor or nurse not being allowed to go to where they were needed. And so that sort of fell by the wayside. And related to that, something that I'm pretty confident is going to end up being permanent. We finally had the breakthrough that telehealth encounters became billable. And that meant that, that wasn't just a licensure issue, it was a billing issue more than anything, because, you could call your doctor or you could do a video chat with your doctor, but they couldn't get paid for it until now, until those rules were changed. And they were changed both for government programs and for private insurance. And that's been extended, I don't know how many times, probably 10 times now. That's got to be made permanent. I'd be shocked if it's not made permanent. The insurance companies have always been against it because of the idea that there would be overutilization. If you make getting medical service too convenient, people who don't really need it will use it, has been their argument. I think that's a pretty bad argument. I think that's been disproven. We've had very low utilization throughout, even as we've liberalized it. And you want people to be able to get healthcare at their convenience when and where they need it, because you can prevent more severe, more expensive problems in the future. And so I don't think that reform is going away, and it shouldn't go away. And I think that
I was pleased with some of the little victories, allow you to buy a cup of beer or wine from a restaurant and take it home. Breaking
home delivery of liquor in a lot of places was legalized as well. And there are a lot of sort of annoying lifestyle restrictions that never had any good justification, sort of fell by the wayside. And I think it's important that we not allow them to come back. One of the things that happens when you're in sort of a crisis is you find out which things are completely unimportant and indefensible, and they fall apart pretty quickly. And that kind of thing I would certainly put in that category. And it just, how did it ever make sense that you could order a meal delivered to your house, but they couldn't include alcohol? But that's who can defend that?
Well, the liquor industry, or at least the liquor store industry for a while. Just a reminder for viewers and listeners to like to solicit your views and your questions. We promise we'll do our best to address them during the show. If we can, I'll see them here on the comment section. If not, we'll respond by Twitter or Instagram. So keep that in mind. Love to have additional questions or thoughts. Phil, I'm watching a couple of the end of state legislative fights, Arizona and New Hampshire, where there are arguments by the Michigan, Kentucky, where the legislatures are saying, those emergency laws that were passed sometimes during riots in the 30s or in the wake of 9/11, giving governors tremendous power without apparently time limits to it, like, come and check it up every month or two to see if it should continue. Legislatures have been fairly aggressive about culling back some of that power, or even if you kept the powers relatively the same, we, the legislature, will give the governor the power to do it, and you can have it for a month, but then you got to come back and you can extend it for a month, at which point some of the excesses that people were laughing at or outraged by, arresting people for fishing in the middle of a lake by themselves, that sort of thing would probably be banned in the next month's reiteration of this, or closing down churches and stuff. Your take on how much of that has been done versus how much yet needs to be done?
Well, I think this is so important, and probably the most notable state in this regard is Pennsylvania, which passed two constitutional amendments to do this on the ballot as a way to get around the governor and sort of tie his hands. And look, the best predictor of whether you would have any type of restriction over the past year was the party of the governor, more so than the level of COVID or anything else. And we Democrats showed they were extremely restrictionist, and they were for every lockdown measure and mask mandate you could imagine. Republicans, by and large, were better, though not without a few exceptions. And, we had this situation, to your point, Grover, where, if you have an acute emergency, you've got to deal with an earthquake or something that's happening right now, then you can understand why you might want to have a process to sort of suspend the normal legislative approval and just deal with the emergency that's at hand. But when something is an emergency, and it's an emergency for this month, and then the next month, and then the next month, and the next month, and you get into years, you've lost your whole system of government if you have one man rule by dictate by the governor, rather than things going through the legislative channels and your elected officials having an opportunity to vote on them, and our system of government functioning and working the way it's supposed to. And, we can't tolerate essentially open-ended, rule by dictate by governors, and we had that in many of these places. I'm encouraged that that legislatures are pushing back on that and asserting themselves, and I wish it would have happened sooner, frankly, but at least we should have better institutional arrangements in place if something like this ever happens again.
When there was the flood in New Orleans in Louisiana, one of the things the city of Louisiana did was they went out, the city of New Orleans did, was they went out to people in isolated homes and stole their guns. Not to drop off bread and water, but they had a list of people's guns and they went out and took them. As a result, after that, the Louisiana legislature passed a law that said during an emergency, the one thing you cannot do is take people's guns away, particularly if you're not sticking around with police protection for looters. But another 12 states heard about what had happened in Louisiana and also passed similar bans. So I know that some states are looking at rifle shot issues on, one thing to go after, or my preference is whatever you're doing, I think should take the legislature to act, period. Yeah. In a day with airplanes and cars and email, you can have a vote pretty quickly on a real emergency. It may take longer to get a fake emergency going, but on a real emergency, you can move and have that lapse every 30 days or so. In Michigan, there were two emergencies, one from a long time ago, one more recently, and the governor chose the one that was more restrictive and allowed her to do anything. And that's the one that'll be on the ballot to be repealed, despite the governor's effort, and I think the attorney or secretary of state up there not allowing it on the ballot as long as they could. Now it's finally going to make the ballot. We may in 22 have a series of those, particularly in states with red state legislatures and blue governors, ones where that will be on the ballot in a number of states, and people will be choosing a governor and talking about the abuses by the previous governor on civil liberties during this COVID.
Well, I think it's interesting. One of the things that I worry about in a lot of these states, though, is that a lot of these governors that I think by any objective measure had horrific records that imposed, massive suffering and economic damage and business destruction and school closures with no benefit to speak of in terms of they have high approval ratings anyway in many of these states, which is, I think, testament to, how, dishonest and deceptive the media coverage has been, how much fear there was that was stoked and created. And just the other challenge that we've got is, I think in a lot of these places, the more liberal places, they don't understand that their experience was not the same experience that everyone had everywhere. And so, in a state like Maryland, which is all the way at the bottom in terms of schools being closed, they're like, I think California and Oregon were slightly worse, but they were right there at the bottom. They were closed the vast majority of the school year. You talk to people and they don't know that in places like Florida and Texas, schools were open and relatively normal all year long. So they don't necessarily understand that they suffered a deprivation that was not universal. And so I think one of the challenges that we have is to show
COVID in the rearview mirror. Yeah, we can have a conversation about, you do know that you had no better health outcomes than this other state, and they didn't do those things. This was all, or much of it was unnecessary. In that, we have a question from Sci-Fi Con. So were masks ever effective, or what's the thing about masks? Yes, no, maybe, sometimes, at one point.
there is, if you look at all of the studies, and there are a lot of them, and there's a reason that, for decades we never recommended masks. If you look at all of these studies sort of as a whole, there is weak evidence that they may have a small effect, but it's not statistically significant. And so there have been about 10 random controlled trials for masking for respiratory viruses. And they all have something in the narrative section about, yeah, we think that they might help a little bit. And then they all show that the statistical effect is not significant. And so it's sort of choose your own adventure, in that you could believe that, there's no proven statistically significant effect, they don't work, they should never be used, or there's some evidence here that they might help a little bit and we have nothing else, so we should do it. My problem is that, especially when you make things mandatory and you social pressure people and all this, they were acting like it was this great silver bullet that would make this huge difference and it would alter the course of and it definitely didn't do that anywhere. And so, did it have no effect at all, or did it have some very small effect, is a legitimate debate. But to me, it was never worth mandating, or the disruption, or the lack of normality that masking imposed. I think that if you wanted to present the data and say, this is something you might want to consider, okay, fine. But the idea that on that evidentiary base, we would make it mandatory anywhere for anyone, I find outrageous. And the fact that it was done to children who were at near zero risk with this virus, I find particularly outrageous. And so I'm definitely strongly anti-mask mandate. The question of, can a mask ever help in any circumstance? I would say not much, maybe a little bit, but not much.
The idea of shutting the economy down, or much of the economy down, for 2 weeks is what it was supposed to be. Did that make any sense? Has that ever been done before? Or is that somebody's new theory of the universe?
This was actually first put into pandemic planning as an option during the Bush administration. So we can thank some of our friends for doing that. It was never previously considered, until then. And all the pre-pandemic planning guidance, sort of the official pre-pandemic planning guidance, still didn't incorporate it as recently as 2019, CDC or WHO. But the theory behind it, and there's a whole mythology around how it came into the Bush administration. There's some articles suggesting it was originally like a high school science project or something like that. But the theory behind it was that you can limit human contact, and so you can slow the spread of a disease, and you can buy time for building up hospital resources and being prepared and so forth. In practice, as a short-term measure, I think that to be effective, you would need to lock down a lot more than we actually did, because we had to designate, for obvious practical reasons, you have to designate large swaths of the economy as essential. You continue to have food in there, so you still have a lot of human contact. And so you're not really going to have that massive sort of break on everything effect that you're theoretically looking at in the models. So I'm sort of skeptical that as implemented, it could even have a short-term effect. Now, the easier question, though, Grover, and the one that now matters because of the way the policy actually was implemented, not as a 2-week short break, but as sort of an open-ended, let's impose varying degrees of this for a long period of time. There was zero benefit to that. And it's pretty clear that the places that did it had no better outcomes than the places that did not. You might slow the spread of infection in certain circumstances slightly, but it's still going to spread to the same percentage of the population, just maybe on a different time horizon. Our hospitals generally were not stressed. They were actually underutilized because people were scared to go there for other health problems. And so there was no, as implemented, there was no benefit to them. And whether theoretically there might be a way to do it that would have a benefit is a tougher question. I think that, you could at least imagine a circumstance where every single person interacts with no other people for some period of time, and that might stop a transmission of a virus. But you can't do that in a real society because you got to provide food, you got to provide power, So I think the kind of lockdown that might actually work, I don't think is actually possible to be implemented. The kind that we had accomplished nothing except imposing massive economic suffering. And of course, the other problem, Grover, is you have this massive sort of you have this, I don't want to use the word equity because it's such a left-wing buzzword, but you have this massive disproportionate impact on lower income people, on racial minorities, on people who are more likely to have jobs where the definition of the job involves showing up somewhere versus people who have jobs that can be done remotely. And so, you had this sense among sort of rich people that they were somehow behaving virtuously because they were paying less well-off people to go take all the exposure risk for them and go deliver everything to their house. And, did you actually reduce risk or did you just transfer it?
Yeah.
So
Phil, I'm going to do a little comment to begin to close it out. But when we come back to you in a moment, I'm looking for two broad thoughts. Is what country or countries did this most poorly? And what country or countries did best in terms of lack of damage both to the economy, to civil liberties, to health? And the same question for states. We've kind of mentioned some of the states, but I'm thinking countries and then states, good, bad, ugly. And just to wrap up before we get those final answers from Phil, I want to remind you that Leave Us Alone with Grover Norquist is both a video and an audio podcast. If you like what you see and what you hear, be sure to like and follow us on Facebook and subscribe to Americans for Tax Reform on YouTube. Hitting the thumbs up button would also be greatly appreciated. Your engagement with the show helps more people learn about it. If you're more into audio podcasts, you can Leave Us Alone with Grover Norquist on Apple Podcasts, Spotify, and Stitcher, or wherever else you get your podcasts. Please do leave a review. Phil, countries and then states. Who did it the best so far? Who did it the worst?
Well, it's a little bit tricky to do these comparisons because they're definitional differences. In particular, the international ones, there are big differences in the way they define COVID deaths, for instance, and the case numbers depend heavily on how much testing you do. And so understanding that there are provisos on all of this. The Nordic countries did the best, not just Sweden, which has got a lot of attention, but all of the Nordic countries had relatively low stringency interventions, but did very, very well. And you could say social cohesion, relatively homogeneous population. People can come up with excuses for why it's the case, and they may or may not be valid. But I would say as a group, the Nordic countries did the best. The worst, the United Kingdom is up there. They had a pretty catastrophic outcome in terms of deaths, and they're still in a kind of lockdown, although supposedly it's their Freedom Day that's been postponed a few times is supposedly coming up, I think next week now. But the number one worst in the world in terms of death rate is actually Peru. Deaths per million. They are the worst in the entire world, and they also had a military enforced lockdown for, I don't know how many months on end. And so, maybe it was a coincidence, but it certainly is pretty strong evidence that these types of lockdowns are not effective, that the country with the highest death rate also had one of the harshest lockdowns. And in the United States, I would say, and we're actually working on a study. I'm working on a study with Steve Moore on this. We're going to rank all the states on sort of virus outcomes, economic outcomes. We've got a variety of things. So I've got a more full answer coming in written form sometime in the next couple of weeks. But I would say that the pretty clear overall number one is Utah. They did very well in terms of they had the kids in school. They had very good economic numbers throughout, and they had a very low virus burden as well. So I've run the calculations several different ways, and they're sort of always number one. So take from that what you will. But in terms of the big states, the large states, I think that Florida did the best job. Their economic numbers aren't tremendous because the hit to tourism there's nothing they could do about that, and that keeps them from having really good economic numbers, obviously. But the fact that they're ranked 40th in age-adjusted COVID deaths is a really remarkable achievement that was done substantially with their economy open almost the entire time, other than a 3 or 4 week lockdown.
Okay, excellent. And worst?
I would say that the worst are New York, New Jersey are really at the top. If you want to give them an excuse because they were hit before we knew what was going on, then you could say sort of New Mexico, California are also quite bad. If we include DC in our list, they're at the bottom also.
Oh, wonderful. Okay. Phil Kerpen with American Commitment. Thank you very much for joining us at Leave Us Alone. And we'll see everybody again in a week. Phil Kerpen, thank you very much. The material you've put out on this subject has really been helpful. And oddly enough, I haven't seen it on ABC very often. So, Phil, thank you. Take care, everybody. See you next week.